Okay, so I found something interesting in my hospital emergency room visit records. This is from St. Vincent's East Hospital, Birmingham, Alabama, Ascension Health. This was on my April 22nd, 2019 visit. And I've been doing some research on EMTALA, that's EMTALA. And that's the Emergency Medical Treatment and Labor Act. And I believe that I may have been a victim of patient dumping, which is something hospitals do, and it involves a patient's ability to pay for treatment. And this involves insurance, proof of income, things like that. They ask you those questions when you go to these emergency departments. And in these patient dumping incidents, the inability to pay results in a lower standard of treatment or no treatment at all versus adequate treatment or some higher quality of treatment. That's what it boils down to. So anyways, I've been researching my own case and experience, with some new information that I've learned about EMTALA and patient dumping. I found something interesting, which I will share. In my emergency documentation from April 2019, I was under the care of a nurse, Kimberly Burns, CRMP, as well as Frederic M. Jones, MD. And they both signed off and provided some observations in these records. All right, so it says here, FMJ MD. I was available and consulted with the APC regarding this patient. Additionally, I personally examined the patient and participated in the history and medical decision making. I agree with all clinical information unless otherwise noted. All right, so the key item in this statement is this acronym APC. Now, APC, it could refer to Advanced Practice Clinician, and this is like another word for a nurse or like a physical assistant. It can also refer to Ambulatory Payment Classification, and this could be related to EMTALA. And I think it may have been some kind of code word in regards to my stated ability to pay for treatment. Ambulatory Payment Classification. And the Wikipedia page says, are the United States government's method of paying for facility outpatient services for the Medicare program. So you research EMTALA and patient dumping, and this is a related subject to this. So, what's he talking about here? He doesn't elaborate. But the use of the acronym is interesting, because why don't you just say nurse, right? APC payments are made to hospitals when the Medicare outpatient is discharged from the emergency department or clinic, or is transferred to another hospital which is not affiliated with the initial hospital where the patient received outpatient services. Although APCs began through the federal system of Medicare, they have also been considered for adoption by state programs. If the patient is admitted from a hospital, clinic, or emergency department, then there is no APC payment, and Medicare will pay the hospital under inpatient diagnosis related group DRG methodology. All right, so just something to think about. Because what I've found through this entire thing is these doctors were using all kinds of surreptitious tactics. It's their own world. They got their own lingo, secret handshakes, and a lot of the stuff takes place compartmentalized environs, and the whole thing is some kind of antiquated throwback to system from the dark ages, basically. So how does this relate to my injury? I went to this hospital and I had some computer tomography scans done of my neck and my head. The results came back. Dr. Julian Patrick Druhan was a reading radiologist on these scans. He noted, no acute finding, basically nothing remarkable or out of the ordinary. And I was told these scans came back normal. And this couldn't contradict more with the feeling that I had. The hospital doctors, they took the radiologist's information and they basically told me I had pulled a muscle in my neck. I knew they were wrong, way off base. My neck felt like it was broken. But I found out when I obtained my medical records and these actual images that cracks, breaks in the bone of the underside of my skull show up. And these were not noted by any of the doctors involved. I had to find this myself afterwards. So this is how I think this relates to EMTALA and possible patient dumping. If I had a broken skull, this is going to be a major undertaking for any hospital to adequately address and